We've been with this ambulance crew since this morning. We're on our way to see our 7th patient. We've seen 6 already, and it's only halfway through a normal shift.
It's just come in about 30 seconds ago. It's for someone who's having a severe allergic reaction. Their lips are going blue.
Ambulance response times across the country are growing longer than ever. Responding to life-threatening calls takes 30% longer than before the pandemic, while getting to emergencies like heart attacks and strokes takes twice as long.
It can be quite disheartening sometimes hearing across the radio all of those calls that are waiting for an ambulance because there's no ambulances available. Patients can't be moved from A&E into those different wards or into social care, so there's no space to put the new patients when we're bringing them in, which then causes further ambulance delays. So I'm just going to come around the back if that's all right. So if you just take some nice big deep breaths for me.
Maggie is 9 years old. Her mother Rochelle called emergency services after becoming frantic with worry.
Brilliant. That's all really good. That's really good. Has anything like this ever happened before?
Like you said, 4 years ago.
What happened 4 years ago? Sorry, I think I was...
Same thing, like pale face, really pale, and the same thing, I'm very sick, but she meant she's weak.
Yeah.
Maggie's condition is now stable, but Gigi and John decide to take her to hospital for further tests. The A&E department at the Queen Elizabeth Hospital in Woolwich is one of the busiest in the country. They've been facing the sort of pressure usually only seen in winter, but all through the summer, as many as 600 people a day. A job made much harder because the Trust has 70 patients medically fit for discharge but can't leave because they have no community social care package in place. Around 500,000 people are thought to be waiting for a care assessment or funding. Carol has terminal cancer. She needs round-the-clock treatment. But rather than being treated in hospital, she's receiving community care in a hospice. And I suppose it makes your family feel quite relieved that you're receiving such expert care.
That's right. We haven't got a big family, like me and my sister. But what we have got, we love, and we like to know that we're all happy. I've never been to a hospice before. They were like a dirty place. But when I see this, it was like going into a fairy tale.
Carol's life-prolonging care, like other services across the social care system, is under pressure. Hospices and care homes are facing multiple challenges.
That growth of patient need, population, complexity of symptoms, particularly post-pandemic, where people haven't accessed healthcare in the same way over the last 2 or 3 years, you're looking at people with much later stage disease. And that's really complicated. So we'd love to do more, but our limiting factor is staffing.